Hey, thank you for joining us on Facebook. I'm Mark Peterson. This is Heidi Frazier, Director of Marketing for the Rehabilitation Hospital of the Northwest, and we're in Post Falls. Thank you for, again, having us here and hosting this. For the next several minutes, you're going to be introduced to different players that do different things when it comes to heart health. This is February Heart Month, and there's a lot going on here.
Absolutely.
Okay, this place really deals with, again, cardiac. It deals with a lot of other things for people, but we're dealing with the heart today.
Right.
What are some of the things that you guys do here?
So we are an acute inpatient rehabilitation hospital, and we have patients here that are needing physical therapy, occupational therapy, speech therapy, so that they can improve their function and their safety, and the whole idea is to be able to get them home. We strengthen them and we educate them on medications, different assistive devices, so that they can get home safely, and they're monitored by a physician. So
okay. We're going to show you a lot of those things throughout the next several minutes, and I think you're going to find a lot of what they do here fascinating and needed. And I think that would be the key. This is stuff that is saving lives and improving lifestyles.
Absolutely. We are proud to say that we've been in the top 10% for patient outcomes across all inpatient rehab hospitals in the United States. So what that means is we're making a difference in patients' lives. Our goal is to get them home stronger, and safely and better educated so that they can live a full life.
Okay, so they're eating better, they're exercising, right? All the things we should have done before ending up here.
Yes.
All right, let's talk a little bit about, you have a bit of an open house coming, yeah?
We do, yes. In celebration of Heart Month, we would like to invite the community to our hospital on Tuesday, February 13th. The event starts at 2 o'clock. We'll have healthy refreshments, of course. And
there's always that.
Yes. Free blood pressure checks. Ted Duncan will be here from the American Heart Association. We'll have some other outpatient and exercise groups here to educate patients on different options. And there'll be a presentation on wellness, prevention, and what inpatient rehab and other exercise programs can do for patients after they've had an acute event. So we'd love to have anybody come that wants to learn more.
Okay, and may need the services at some point in time. So important that people, it's education.
Absolutely.
That's really what's going to help us turn the tide on heart disease, is that we continue to educate people. And you guys do a beautiful job with that.
Thank you. Yes, we try. Yes.
Okay.
We absolutely love our community, and anything that we can do to help them prevent a future event for somebody, we're in it.
All right, and so are the employees here. Really, they do take this matter to heart. All right, over the next several minutes, you're going to meet several people that play a part in this, including Ted Duncan with the American Heart Association. What you're looking at is a pool, but not an ordinary pool. This is where therapies are done at Rehabilitation Hospital Northwest. Joe Taylor joining me. He's a physical therapist. And this is, again, one of those items where if you've never done pool therapy, it's a breath of fresh air. I mean, it's completely different than being in a gym setting.
It is, and we just wanted to tell people that this is a different way that you can get some therapy or exercise in, whether it be after an event occurred or, you know, to prevent a future event from happening. It's low impact, it's good on the joints. Our pool's at 92 degrees, so it's relaxing to be in.
Let's get back to that. 92 degrees.
92 degrees.
You're in the pool and you're working with them side by side.
Yes.
And it's a lot of it is resistance. So this weighs a couple of ounces.
Right.
But it's pushing and pulling this through the water that really helps the muscles and the heart.
Right, so the pool provides a safe environment in which to learn exercise techniques, and then the more you advance you get in the pool, the more we can use these type of weights or resistance on the ankles and stuff like that to really provide the resistance that, you know, you can't get anywhere else besides in the pool.
Now there are those people who say, I've got a bad back, I've got bad knees, I had a hip replaced, I can't get exercise in. This takes that away from the equation, right?
Absolutely. So we have specialized ways of getting those types of people into our pool and out of our pool. Our therapists are always with them one-on-one inside the pool. And plus it provides a relaxation, which you don't get in land therapy. So it takes a lot of the weight off of a person compared to land therapy, and it provides relaxation afterwards.
The other cool thing is you have a way to get people into the pool if they're in a wheelchair bound, things like that you can bring them in, set them in, and then you can do the therapy and then bring them back out.
Right. Many of our patients can't do stairs, and that's why they're here. So we have our specialized lift that we can lift people in and out of the pool with no problem, and so they don't have to worry about getting in and out by themselves. We'll always be with them.
So let me ask you this. What's it like when you've had someone in here, they've been doing their therapy for a couple of weeks, and then pretty soon they start seeing this improvement?
A lot of patients will see improvements even on the first day, because you take a person that can't walk on land, you throw them in the pool, you take 75% of their body weight away and they're walking around, and it really invigorates them to participate more in therapies here. And then we start to transition them back onto land therapies, and it's just a great place to start and to keep coming back to.
All right, and again, we're talking about when it comes to exercise, half an hour every other day, it can be broken up, but when you come here, the pool therapy, dare I say 92 degrees, your therapist is right there with you. But it is that important part to get your heart healthier by getting it working again, and that's what it's all about. No matter how limited your movement, something like this can really be a great assist. One of the things we have to talk about when we talk about heart health and overall health is our diet. And Betty Patch joining us, dietitian, and again, Rehabilitation Hospital Northwest, RHN as you call it. So here's a perfect example. We don't need to change so much, but it's hard for people to even make these changes.
Right.
What are you trying to tell people?
Well, the biggest thing we're trying to tell people is to eat a healthy, well-balanced meal. And the Idaho plate method or the Choose My Plate method are great examples of that.
Very similar. I mean,
similar.
Yours is in more detail. Everyone gets one of these in their packet.
Correct. Every patient that admits here gets one of these in their admission packets.
All right. We eat too much protein as a society. We have too much meat and not enough color, as it were, in our diet.
Correct. So adding more vegetables and fruit, starting with that, half of your plate should be fruits and vegetables, and then planning your protein around that. So adding that quarter of a plate worth of protein and a few whole grains, focusing on whole grains, avoiding the white flours, the white sugars, and the white foods.
Which, as in America, we eat a lot of and have a lot of that processed wheat and processed sugars that are coming into our diet constantly with prepared food. So that takes me back to one of my favorite topics, and that's cooking food in your kitchen. You know, and broiling and not using the oils. It's not hard to do, but it's sort of like maybe what Grandma used to do.
Right, and I think we fall short in that because we don't plan ahead. So if we're planning before we leave for work in the morning what we're going to be eating when we get home, it's going to be much easier for us.
Put the chicken out to thaw so it's ready when you get home instead of going, oh, I'm just going to pick something up on the way home.
Exactly.
So easy to do, but it just tears at our body.
Right, exactly. And then we're getting too much sodium in our diet that way too. And those processed foods too, those prepackaged TV dinners are loaded with sodium. And that's so bad for our heart and our blood pressure.
So we need to really just look at the big picture, do some meal planning, don't fear the salad.
Exactly. I love that term.
Yeah, I know. And my cardiologist says, Mark, really, a little green would really help you out. And so what I've gotten to do is that I'll barbecue up, I'll take a chicken breast, cut it in half, and then I'll sear that and barbecue it up, and then cut it in slices and put it on a salad.
Perfect.
Okay, so at least I'm getting 2 of the 4.
Yes.
You know, what do you suggest for good grains? What's a good grain?
Whole grains, whole wheat flours, whole wheat breads. Quinoa is very popular right now. Couscous are another really great grain.
What about the rices? Now, people tell me to stay away from the white rice. And you know, I guess everything in moderation, but rice is whole grain rice, I'm assuming, long grain rice?
Yeah, brown rice, wild rice is wonderful. You
Delicious.
can mix brown and wild together and makes a wonderful meal.
Okay, you're talking to somebody who just says, I need to drop weight, I need to get a better health going. What message are you pounding into their brain?
Really, portion control is so important. So like you were saying, cutting your chicken breast in half, maybe you're sharing that with someone else. Looking at the portions, the size of the palm of your hand will be the size of your meat, and the size of the whole hand will be the size of your vegetable serving.
So I'm going to add to this what my cardiologist, he goes this and then this. So he spreads this for you. Goes, that should be your salad and stuff like that, and then you should have your 6 ounces or whatever it means. What about numbers of meals a day? This is where, back in my day, I was eating 1 meal a day, and the body just, that's not good.
Well, and for a couple of reasons. Our body breaks the fast by having breakfast in the morning, and it starts our metabolism going, and so it's burning energy all day long. It also spreads your proteins out throughout the day. Our body doesn't store proteins for hormone growth and all of those things, so it's so important to have that spread out throughout the day. Another thing that it does is it helps us to not be so hungry when we're coming home for that dinner meal and overeating. Or choosing the wrong things on an impulse.
Good breakfast, good lunch, smaller dinner, and do that 5, 6 o'clock. Don't do it late at night.
Right. Best not to eat past 7 o'clock at night. It's just a good habit to get into.
Dietitian Betty Patch, thank you so much.
Yeah, you're very welcome.
All right, it's something we all need to learn and do. And trust me, we all are challenged with it, is put more color into your diet, greens, purples, vegetables, and also the portion control is so important. All right, February is Heart Health Month, and one of those things is talking about a heart that's healthy. In order to do that, you're born with a healthy heart for the most part. And joining us now, again, is Nicole Rostrom, Director of Nursing. And hello.
Hi.
All right, so we start pretty much with 100%, everything is good. And as we get older, we tend to ignore things. We tend not to exercise. We just tend to let life happen.
Life gets busy.
And our heart and our whole body suffers. Now we're talking about heart health. What are some of the things you hammer home to your patients when it comes to heart health?
Some of the really, really important things about heart health is keeping track of and controlling your blood pressure. So they call this the silent killer for a reason, because you don't notice it. Also watching your diet, being physically active. There's a tendency to get busy in life and make excuses, but it's really only critical, that we do 30 minutes a day, 3 times a week, and you can do it in 10-minute increments.
And I think that's a key to this. We keep hearing all the fitness. In January, the gyms fill up. February, they're empty. And February being Heart Month, you think that's when they should be full. But it's just taking those short spurts and getting that heart rate up.
Absolutely. No need to run a marathon, although those are fun.
No, they're not fun, but I get where you're going with it.
But it's just getting that heart going and letting it come back down to normal. So we really just want to exercise the heart at least 3 times a day is what we can do to really help it.
All right, blood pressure. Let's get back to sodium. This is going to be a key in this whole thing, is talking about the salt, the sodium, the prepared foods.
Right.
Salt is not our friend.
No.
We need salt and we need some of the stuff, but we're getting way too much.
Right, exactly. And salt is really going to contribute to an elevated blood pressure just because it causes you to retain volume.
Right.
So it's important to eat a healthy diet, limit your salt intake. Also, another one is no smoking.
Okay.
That's a big risk factor for heart attack and stroke and heart disease.
Right.
So it's really critical that anyone who does smoke quits and that we don't start.
Yeah. After a couple of years, your body's going like, you're doing pretty good. Everything's rebuilding. I mean, and in fact, they say in the first week you already have
you can
repair.
correct the damage that you've done by just quitting.
Outstanding.
So it's never ever too late.
All right, so I'm going to chit-chat a little bit about men versus women.
Okay.
It's not a contest, but women are losing when it comes to heart disease.
Absolutely.
And during heart attacks, they've got different symptoms and stuff. So really, this message goes to both, but for the women, they've really got to be careful.
Absolutely. I think that women have a higher rate of death from heart attacks because our symptoms are different.
Right.
And I think men, you feel the pain in your chest, in your jaw, your arm, you think, oh, I'm having a heart attack. Women are like, I feel a little dizzy, something's not right, let me drink some water.
Yeah, my
I think
back
I'm dehydrated.
hurts. I gave birth, this is nothing.
Exactly. So for women, it's especially important to see their doctors regularly, make sure that they're getting their checkups. Some things you cannot outrun. Heredity, you can't outrun. So if your dad died of a heart attack and your grandpa, then it's really important for you to monitor especially. So important for both men and women, but women are really losing on the deal.
And for women, they say a lot of success is if they have somebody to walk with, if they have somebody to do stuff with, so it's not a solitary deal and they can have some fun with some friends and still get that heart rate up.
Absolutely. We're social.
Okay.
So we like to talk.
This is so true. You and I will get along great. All right, the bottom line is that, as this says, eat smart, add colors, move more, and be well. Believe it or not, if you do these things, your whole body benefits. But really what benefits is the pump that makes everything run, and that's your heart muscle. I want to introduce a friend of mine, someone who we've worked together because of, again, my event and over the years just being in media. Ted Duncan, the Executive Director of the American Heart Association in Spokane, in the region. Thank you for joining us.
You bet.
All right, you know, all year long we talk about heart health, we talk about exercise, but February, man, baby, this is your month.
You bet.
This is all about the heart.
We're excited. We've got so many things going on, you know, from getting the word out. You know, awareness is such a big thing with what we do, and get people to understand the importance of heart disease, what to do, how to prevent it. And so we get the message out there. We have different activities going on through the month. It's great.
Dare I ask, are some of the messages falling on deaf ears? We still have so much heart disease out there. What are we not doing?
Well,
or what do we need to do better? We'll be positive. What do we need to do better?
You know what we need? We need more voices. We need more volunteers, people, you know, from professional people, doctors, nurses, things like that, in the hospitals, spreading the word about heart disease. People like you on an everyday basis, getting the word out there, saying this is important. It affects so many people, and today's the day. You know, don't get frustrated if you're not exactly where you want to be with your health. You know, you don't have to go from A to Z. Let's go from A to B. And let's start making some small changes.
Small steps. It's sort of like the same thing with quitting smoking. So many people can start up again. You can quit again. Okay, you just take it in, just get it done in the end. Now, I'm going to pick on a population. I'm going to pick on women. With love in my heart, out of when you look at the women's death, 25% of it is directly related to heart disease, and it equals more than the cancers combined. I mean, it is devastating. We're not talking about it, now we are. What are we trying to tell the women of the, you know, the world?
Well, I'm glad you bring it up, because we need to get them to take action, and they don't. They're so busy taking care of everybody else, taking care of us, that they don't take care of themselves. But they need to understand, if they don't take care of themselves, they won't be able to take care of all their loved ones.
So if we have problems with blood pressure, diabetes, if we have issues with a history of heart disease in the family, this is a conversation that has to be held with the doctor. And that's a one-on-one relationship that is just incalculable as to how, you know, how much that relationship and that conversation has to take place.
Oh yeah, I mean, firstly, make sure you go to the doctor. And then second, be prepared, talk about it. What can we do? What, you know, how can we reduce our risk for heart disease? You know, it could be as simple as just relieving some stress, taking 5 minutes a day, close your eyes. Not a bad deal.
Meditation has helped with blood pressure, taking some quiet time. A lot of women don't do that. The other thing that is crazy, and I've talked to women about this, they go like, well, you tell me the signs are all over the place. If I went to the hospital every time I had a backache, I'd be living there. I get that. But it's associated with other things. But the signs are different for women. You know, there's some of the classic, but a lot of them are different.
Yeah, what I would say is, if something is really different from one day to the next, or 1 hour to the next, something really odd, you know, that just kind of pops up, that's cause for concern. And you know, I'm not a medical type person, but I hang around a lot of them, you know. So it's, you know, take that precaution, because there are many stories of people saying, my loved one didn't go to the hospital, or I didn't go to the hospital. And so we really prefer them to go to that urgent care emergency room and to be told, you're okay.
And get checked, or thank goodness you're here, we're going to take care of you.
Exactly.
For the guys in there, don't drive yourself to the hospital. I've had it happen a couple of times. A couple of guys go, I drove myself. And I go like, no, don't do that. Make sure that you make that call. 911 is your friend when it comes to a cardiac, because the guys that show up, they're ready to help you.
Oh, sure.
The guys and gals with, again, emergency response, they're really qualified.
They're all part of the network. They are in place to make sure that they take care of you. So make sure you utilize the tools you have in front of you, the EMS and 911.
Let's talk about Go Red for Women.
Sure.
So that sort of brings us in. Big luncheon coming up.
You bet. We have some great momentum around Spokane here. Our volunteers are awesome. Gosh, it's happening on February 21st, Spokane Convention Center. And you know, this is bringing attention to something that needs a lot of attention, and sending the message to the women to say heart disease is serious, and take care of it. Every woman that walks through that door will take one step. You know, they'll do one thing to improve their health or more. But it's something we're really proud of. People that come to that luncheon, you know, we send a message, they receive
They hear it. It's there, and they're open to the information.
You bet.
Last thing, you're doing some cool stuff with newborns. What's that all about?
Oh, we got it. It's such a great awareness tool. It's Little Hats, Big Hearts program, and our friends at Wheatland Bank are helping us put it together for the month of February. We have a lot of volunteers that knitted little beanies for babies that were born in the month of February, and the local hospitals are delivering them. You know, as the babies are delivered, they're giving them one of these babies or one of the hats, and it's meant to create awareness for heart disease in general and about heart defects as well.
All part of the conversation. And that's what I've been talking about on this whole thing. It's these conversations about diet, exercise, family history, you know, and it's so important. Ted, thank you so much.
Bet.
The American Heart Association, look them online. They've got a lot of great information, again, on smoke cessation, getting in shape, better diets, and really February is really their month. The American Heart Association, and again,
we own it.
Our heart, you own it. That's it. All right, well, I tell you what, you really need to continue to talk about these things. Trust me, the more you talk about it, the easier it gets.
For sure.
All right, so October 24th, 2012, I had what they call an event. Full-on heart attack. I died, they brought me back, and I was blessed and lucky in the fact that I didn't need much rehab at all. But when you come here to Rehabilitation Hospital Northwest, that's what they do. And Sharon Bartlett joining us now, occupational therapist, and thank you for joining us.
Thank you.
Let's talk a little bit about rehab. It is that point in which we start to see the patient get better. I mean, they've come through the event, and then they come here. What's going to happen?
That's true. So in rehab here, we as therapists, through information from the doctor and the patient, we're monitoring their heart rate, we're looking at their oxygen saturation, blood pressure, all while we're working on self-cares that they need to get back to doing independently and safely. And also while we create a home exercise program for them that they can take home with them, or we do exercises here.
Okay, it is tantamount to success that we actually do the exercises.
It's very important. I'm an advocate of that, yes.
I mean, it is. And there are so many different exercises that can be done that you guys are trained in and you know that can really help those people, so that sort of breaks up the monotony. We get bored easily. I'm just telling you, we're in America.
Right.
We get bored. You have those things to work with then when you send them home?
We do. When they get here, depends on their event, what type of procedure they had before they arrive here. Because a lot of patients, after an event, they have certain restrictions.
Right.
Say they had a cabbage and now they have sternal precautions. There's certain ways they can't move, certain things they can't do, and we are here to teach them how to live their life independently, safely, within those precautions.
For those people who've been through therapy, and I've talked with some of them, it's amazing how there's fear after an event.
There is.
When you do exercise, when you start branching out, there's fear that there may be something that will happen again.
Sure.
It's one-on-one here. I mean, you guys are right with them the whole time, building that confidence.
Yes. So through repetition and just advancing things slowly so they can see progress, then they start to automatically get back into their routine and feel more confident before they go home.
All right. What's one of the best things about your job?
Oh, it's very rewarding. I get to be here and try and impact them. For those 2 weeks that they're here, I do everything that I can to help them get back home, get their optimal level of function, and just teach them everything that I know about how to get there safely.
I'm assuming that you have to give the guys a harder time than the ladies. The ladies tend to follow directions better than the men. Is that true?
You know, not necessarily.
Oh, really?
Not necessarily.
Not necessarily.
Not necessarily.
I fall into the other category. All right, thank you so much. It is imperative that as you go through life, if you have an event, that you need to listen to your doctors, the nurses, and your therapists when it comes to your treatment. You will improve steadily. You will be better off for it. This is National Heart Month, and this is when we talk about these things. And it should be a conversation that you have in your own home, especially if there is, again, a history of heart disease. If working out beforehand could limit or lessen the severity of an event or eliminate it altogether, depending on it. So talk with your doc, have that conversation. You met a lot of people today, but the message is the same, and it's a lot like this t-shirt, all right? Eat smart, add color, move more, be well. It's the message they continue to hammer every February, but it should be a year-round thing. So again, we want to thank Rehabilitation Hospital of the Inland Northwest for helping us out, spread this information when it comes to heart health. Have a great Heart Month in February, and remember, this message is good 12 months out of the year.